Today, we create a space where stories meet system, where healthcare injustice, often buried under silence, gets a voice. A space where we look at exploitation not just as isolated incidents, but as part of a larger painful pathway, one that has survived independence and continues even 78 years later. We are honored to be joined by people who have committed their lives to truth, justice, and public service. Their experiences are not just perspectives, they are the reminders of the work still left to do. To carry us forward, it is my honor to invite the President of Pakistan Health Parliament, K Chapter, whose dedication to our shared mission is commendable. Please join me in welcoming her to officially open this evening and share a few words about the purpose we work towards together. Anshe, over to you.
Thank you so much, Yushe, for such a warm welcome. I hope you all are here today to take something away with you that is going to help you a lot in future and that is going to make you enable to play a vital role in the society itself. As you all know that the struggle against medical exploitation has been really very long, and we as a developing country have always found us in between the chaos of quackery and malpractice. So, as far as this session is concerned, I hope that it will provide clarity to all of you on a lot of topics. And with the given panel that have been doing excellent work in their professional field, we are really honored to proceed with this session today. Moreover, I would actually want you all to reflect on your individual role in the society as well. We as in youth can actually change the stereotypes that have been existing within this country for a very long time. And if you are enabled to unlock your real potential and know the kind of change you can bring within this society, you are definitely gonna make Pakistan a better place with a better system. With that being said, I congratulate you all for being here, and I welcome all the esteemed speakers who have joined us today for this session, because without your insights and without your expertise, this session would have been unable to execute. So, with that, best of luck. Best of luck to Yushi as well with the moderation of this session. And I hope you guys are gonna make a huge thing out of this session. With that, I would give a brief introduction of you Pakistan Health Parliament itself and the K chapter itself. So the Health Pakistan Health Parliament is basically a non-profit and a social think tank that is non-profit organization and a social think tank that is working towards the betterment of the society itself. And the main purpose is to involve and to channelize the energies of youth into a productive way, and how they can actually lead Pakistan in a really very comprehensive or a fruitful direction. And as far as our chapter is concerned, we came into existence in last December. It was a raw idea with a raw concept that okay, we are going to have committees, and that was the kind of practice that is being followed by all the other chapters within the Pakistan Health Parliament initiative itself. We have student chapters, we have provincial chapters, and there are more than 6,000 people that are working within this chapter and trying to unlock the potential of youth in a broader dimension. So thank you so much for having me here. And thank you so much, Yushe, for letting me interact with the audience and inviting me in. And best of luck with this webinar.
Thank you, Anshu, for that meaningful message. It sets a thoughtful tone for the conversations we will be having today. To begin with, I would like to invite Dr. Masood to deliver his presentation while our team shares the slides alongside.
رب اشرح لي صدري يسر لي امري واحلل عقدة من لساني يفقهوا قولي. Thank you, Yusha. You have provided me an opportunity to discuss the problems arises from 1947 to 2025, especially the nation in which the quackery is very common. If you see the Pakistan healthcare landmark landscape where access and information disparity are prevalent, medical professionals bear significant responsibilities. The basic responsibility to medical profession in this, they provide a equal opportunity for each patient. They have a equal opportunity for the urban areas as well as the rural areas. In Pakistan, most of the urban areas, they are uh, good medical facilities as compared to rural areas and basic health unit. And then the medical profession must prioritize healthcare access. We will ensure that each and every patient should receive the fearful meaning of treatment option, and the preventable diseases. Must practice culture sensitivity means different cultures and different regions in Pakistan, like KPK, Punjab, Sindh, Balochistan. So there is no any disparity between the culture sensitivity. They follow the cultural ethics and the values. Medical profession should adopt the communication to ensure effective care of all patients. It is very imperative for medical community to adopt effective care for all the patient, regardless of their religious ethnicity, languages, rural and urban background of knowledge. Next slide. Here is the patient center. These are the people in which the different governance, information, financing, service delivery, human resource, medicine, and technology. They are the compact thing. They all serve to the people of the Pakistan, and the head, according to the WHO, all organization, institution, resources are devoted to producing health action, including a pharmaceutical and medical technology. So all these six parameters, they are serving to the people of Pakistan. Next slide. According to the Economic Survey 2022 to 23, in Pakistan, there are 1276 hospitals throughout the country, 558 basic health unit, 736 rural health centers, 5820 dispensaries, and 780 maternity and child health, or 416 a TB center. These are the statistics taken from the Economic Survey of Pakistan. Okay, these are the structure. Healthcare personnel, 266,000 doctors, registered medical nurse, 30,000, registered nurses, registered dentists, 30,000, registered nurses, 121. Total bed is 146,000. So 1,540% if the population is 2 to 5 million of Pakistan. So 1,540% के लिए only there is a one bed to survive. So this is the some statics. The next slide. Basically, in Pakistan healthcare, where access and information disparities are prevalent, medical professional bear significant responsibilities. They prioritize healthcare access, and additionally they must practice culture sensitivity. So basically the medical community provide a bridging information. The patient education and patient literacy is one of the factors. Once he is reported to the clinic, the patient, that is the responsibility of the doctor. They provide the proper education. It's not for the education for the disease. It is the education of preventive. It is the education of health. It is the education of the diet, and they are very transparent and clear, or the voice, especially the language used in the chamber of the doctor, is a very clear and understandable. Community outreach program, most of the thing it is seeing that the urban population, they have good facilities of medical facilities, big hospital, tertiary care hospital, primary and secondary care hospitals. But in the rural areas, there is no such tertiary care center. So in this company outreach, they develop some telecommunication or telecommunication, and they arrange some satellite symposium, satellite clinics in that particular areas. Okay. And then the utilization of the technology. Now this is the era of technology in which you can utilize the technology, like we are doing a symposium on Zoom. There is education for the patient. So there is a satellite technology system in which you will educate in that particular areas. Ensure equitable access. You must educate the literacy of the patient, or you will educate the right of the patient in front of the different government and semi-government, private, philanthropic association for the rights of the patient. In this, the resource optimization is very imperative, because in Pakistan the per capita income is very less, and the resources, where we have a very limited resources. So we will utilize these resources in optimization level for the patient benefit. Prioritizing prevention. Prevention is better than cure. So suppose we have a TB clinics, so we will ensure that the patient will get the drugs 6 month, 9th month, 3 regime, 4 regime. Tuberculosis or other disease like diabetes is one of the disease in which, if we educate the people prior, so we will prevent the disease, and the disease burden on the patient is decreased. Every culture has their own beliefs. So in this, the culture belief is that you will discuss with the patient on their beliefs, rather than you will impose something which is not related with him, and you will value the cultural aspects of the patients, because in Pakistan different communities are living. They are the Muslims, the Christians, the Hindus. So we must know as a physician that the respect cultural belief for each other. Tailoring communication. The communication is very safe, very clear and audible. They can understand. If we use, if the person is in the rural areas, so we will use a local language of that particular district or province. Promote healthy literacy. Due to the healthy literacy, you will give some brochure, some educational material, different disease. There is a talk, and then there is a walk and day celebration, especially on the breast cancer, diabetes. They have a particular October is a month for breast cancer, uh, and then you give the information, different talks in the different areas, uh, urban areas as well as the rural areas. All the time, we must maintain the professional standard, ethical standards. You cannot share the information of one patient to the another. You must maintain the secrecy, and must discuss with the patient and their relatives on a very ethical way. And this, the continuous learning for this process, the disease is occurring, then he must be learning about the disease. You will give a clear cut message that this is the disease and this is the treatment, these are the consequences, these are the complication, and these are the treatment option available, so the patient can understand the total process. And there is a certain areas, especially in the rural area, there is collaboration and teamwork. Different lady health workers, they are working in the rural areas, so you will collaborate with other, they're like nurses, like paramedics, pharmacists. You will have a collaborated effort to develop the confidence to the patient. Next slide.